What must a VA Nexus statement say? If you're a veteran seeking service connection for a disability, you may know it can be very helpful to have a VA Nexus statement or a medical opinion to help link your current condition to your active duty military service. Certain things must be included on a Nexus statement for it to truly be effective. First of all, it has to have your current medical diagnosis. Second, should have the medical opinion stated in the correct VA language. Third, it should have the rationale, in other words, the reasoning behind coming up with that conclusion or determining that your condition is linked to your active duty service. Also, it should include current symptoms, treatment, medications taken, and ideally it should also include what medical evidence was reviewed when the private provider determined the medical opinion. So let's talk about the first thing. You don't have a disability unless you have a current medical diagnosis. Very important that that's clearly stated that you have a current medical diagnosis for that condition. Second, the medical opinion has to be stated in the correct VA language. The requirement for service connection for a disability is that it's at least as likely as not, or at least a 50% chance that your condition is linked to your active duty service. It can also be more likely than not, or more than a 50% chance, but if that language is not used, it may not meet the requirements for service connection for the disability. The provider can't say it could be linked, or it's my opinion that it may be linked, or it's possible that the condition is linked to their active duty service. That language is not going to be helpful at all because it doesn't meet that burden of proof necessary of at least a 50% chance. The rationale. The provider should state clearly the rationale behind determining that your condition is at least a 50% chance that your condition is linked to service. So for example, if you're applying for acid reflux condition and your provider is determining that your acid reflux is secondary to the medications you take for your knee disability, it should clearly state, it's my opinion that this veteran's GERD is at least as likely as not linked to the medication they take for their knee disability because their acid reflux has developed since they started taking medication for their knee condition, and the medical literature supports that NSAID use or chronic use of anti-steroidal, anti-inflammatory drugs increases the chance of developing GERD and also worsens the symptoms of GERD. So the rationale should be clearly stated in the medical opinion and supported by objective medical evidence. Ideally also, your current treatment that is being provided for your condition should be listed on there, any medications, physical therapy, whatever it is. And ideally, the provider would say, in developing this medical opinion, I reviewed this medical evidence. So, for example, if you're claiming a direct claim and you had symptoms of a knee problem, for instance, on active duty, ideally you should bring those records in, have the provider review them, and make sure they state in their medical opinion that they reviewed your service treatment records or your medical records from service. So again, that is the best way to state a medical opinion. In my opinion, it's very helpful to have all of that information included on the medical opinion. If you are unable to get a private Nexus statement, it may be very helpful to look into medical consulting, because a medical consulting company would know exactly how the medical opinion or the Nexus statement needs to be stated in order for it to be effective. So that's what needs to be included on a VA Nexus statement.
The information contained in this video is informational and not professional advice. Rely on it at your own risk and see a qualified medical or other professional to discuss